When a school-aged child died of the measles in West Texas last week, HHS Secretary RFK Jr. downplayed the outbreak, calling it, quote, not unusual. Never mind the fact that no one had died of measles in the United States in a decade. Since then, though, the past week, cases are continuing to pile up, including in New Jersey. And now RFK Jr. is amending himself ever so slightly, writing in a Fox News op-ed, quote, this situation has escalated rapidly, and adding, quote, all parents should consult with their healthcare providers to understand their options to get the MMR vaccine. Joining us now is senior scholar at Johns Hopkins Center for Health Security, Dr. Amesh Adalja. All right, Amesh Adalja, I'm sorry. Measles vaccine. Can you say what RFK is refusing to say?
The measles vaccine is the solution to this outbreak, and RFK Jr. is kind of going around that. He's not really giving it a full-throated defense. He's giving it a very kind of anemic, kind of perfunctory type of position on it, when he should be doing what, for example, Trump's first HHS Secretary, Alex Azar, did during the first administration, where it was a very full-throated, very aggressive defense saying, this is the solution, this is the way out of this is why the outbreak occurred, but you're not really seeing that, and I think it's what you would expect.
Why not?
I think it's because he's shown who he is for the last several decades. We know that he's an anti-vaccine activist. We know he is aligned with people who have said that the MMR vaccine causes autism. He wouldn't even disavow that during his confirmation hearings. He wants to make a statue to Andrew Wakefield, who was the guy who made that false statement. So this isn't somebody who actually believes in what he's writing there. I think he's written it maybe for political reasons, and that's what you're getting, is that kind of a response. That's what you would expect from someone like that.
So when you hear measles, you think, oh, God, it's going to be something like the chicken pox. I'll get over it. I'll be fine if I get it. Or, you know, most kids will be fine. Or if they survive it, then they'll be fine. There's some new literature out there, new studies that show that the measles does something that has longer-term ramifications. Can you explain?
So the measles virus doesn't just cause a rash and a runny nose and red eyes. It actually affects your immune system. It actually deletes some of the memory that you have to other pathogens, other infectious disease. So after you get measles, your immune system is kind of crippled, hobbled for some time when it responds to any other type of infectious disease. So this is not something you want.
So it means, like, when you're a kid, you're building up a giant immunity, a set of immunities from all of the various viruses that you pick up in elementary school and you pick up in daycare and whatnot. And so if you get the measles and you survive it and you're 16 years old and you come across a pathogen that you would normally be able to overcome pretty easily, are you suddenly struggling?
Yes, your immune system, your immune response is blunted now. It's been sort of taken a couple steps back because of what measles has done. It's deleted. It literally deletes and kills certain cells that would be there to respond to those infections.
Okay, so remind us again, if you want to get the measles shot, you haven't yet gotten one, what is the normal schedule for measles shots?
So usually children get measles, the vaccine, between 12 and 15 months, and then again around 5 to 7 years of age. You can sort of adjust that a little bit. They're not ironclad, but those are the times when people get vaccinated.
How can you adjust it? Say you have a 3-year-old or a 4-year-old and you want to get them that second shot to build that immunity.
You can call the pediatrician and get it early. They can move it up. It's not really that big of a deal if they get it when they're age 4 or age 5. And certainly if you're living in an outbreak area, it might make sense to have the added protection. And remember, there's a bunch of people that didn't get a second dose because that second dose was added around late 1980s or so. So there's people that were born before then who got one dose, which is good, but not completely optimal. So if you're going to Texas, if you're traveling internationally where there's lots of measles, you may want to get that second dose as well.
What about a booster? I mean, would it be available to me if I wanted a booster and I had those 2 shots? Would it be necessary? Would it be helpful?
It wouldn't be harmful. I don't know if it would actually help you if you're already fully immune with 2 doses of the vaccine. This is one of our most effective vaccines. This is what keeps measles at bay. And I think if you're fully immunized, unless you've had some kind of immunocompromising condition, like you've had a transplant or something, there's no reason to get a 3rd dose of it, but it's not going to hurt you if you get a 3rd dose.
Using myself as the stand-in for everyone else. Dr. Amesh Adalja, thank you so much for joining us in person today. We appreciate it.